Here we are. We've got permission to start. So welcome everyone. My name is David Howard. I'm the co-director of the Global Centre of Healthcare and Urbanisation here at University of Oxford. And it's a great pleasure to have with us today an audience, in-house audience, and also thank you very much for joining online. We also have the star of the show, Professor Oluwole Daramola from the Obafemi Awolowo University in Nigeria, and he's head of the department of urban and regional planning professor at the moment. So, but at the moment, he's also a visiting fellow here in Oxford. So it's a pleasure to have you with you during for a couple of months and also present to the audience today. So you were talking today on processes, practices and possibilities and urban planning deliver healthy cities in Africa. So the format, I think we'll have a seminar for about 35 minutes, and then questions go over to the audience in the room and for anyone online. So if you are online and you want to ask questions, please do scribble something in the chat and we'll make sure that's relayed throughout the room. So onwards. To you, Professor. You can't see your slides, can you? Is that one there? There we go.
Brilliant. Good afternoon to everyone. So the people that are here and people online, I said I'm Professor Oluwole Daramola, the Professor of Urban and Regional Planning from Obafemi Awolowo University, Ile-Ife. And the title of my presentation today is Processes, Practices and Possibilities and Urban Planning Deliver Healthy Cities in Africa. This particular presentation emerges from my work as a Professor of Urban and Regional Planning at the university, and also my ongoing engagement at the Global Center on Healthcare and Urbanization of the Kellogg College at the University of Oxford here. And I will be looking at this topic under the three lenses of the processes and the practices and also the possibilities. But before going to the three lenses, I will need to make us understand the context in which this particular seminar is being discussed. And that is the African setting. And in discussing African urban transition here, I will bring some numbers to the table. As you can see on the screen, you will notice that in the year 2000, there are about 800 million people that were living on the African soil. And 35% of these people were in the residential, were in the urban areas. In the year 2025, that is after 2025 years, and that was last year, the total population has almost doubled, reaching approximately 1.55 billion, and an increase from 35% urban to 45% urban. It is also projected that when it is 2050, the total number of people that will be living on African continents will be around 2.49 billion. And as at then, about 58% of the people on African continents will be living in the urban area. And currently, urban areas in the African countries are experiencing annual urban growth rates of 3.5, which is much higher than the global average of 1.75. And when we look at specifically at the sub-Saharan African urban population, you can see the transition in the chart from the 1950 to 2020, and also the projected to 2050. The population of urban population in Africa as of 2020 was 33 million. This has increased to 830 million in 1970, and currently about 1.2, currently around 2025, more than 600,000 million people are living in urban centers in sub-Saharan Africa. And in 2050, it is estimated that about 1.2 billion people will be living in cities across African countries. And there are certain key analytical points to note pertaining to this. One, there is unprecedented urban growth in Africa. Because Africa is currently experiencing the fastest rate of urbanization in the world, with countries such as Nigeria, Ethiopia, Egypt, Democratic Republic of Congo, and Tanzania leading this transition. And this high rate of urbanization is also facing infrastructure challenges. That is, there is high migration velocity that exerts immense pressure on housing, transportation, and energy grids across the African nations. And when these infrastructure challenges are in existence, surely there will be health system strain. As a result of dense population and concentration in increase in demand, requiring more resilient public health models in order to make African cities to be healthy. And the urban health crisis in African cities is coming up as a result of the fact that African cities are urbanizing faster than health supporting infrastructure and services can keep pace. And this rise in urbanization is generating African urban health crisis in 3 dimensions. There is the first one that I've identified here, which is the public health crisis. The report from the World Health Organization and the UN in 2024 indicated that 71.6 deaths per 1,000 live births existed on African soil. And this is nearly 14 times the rate in Europe and North America. Also, there is the dimension of infrastructure crisis, because only 32% of sub-Saharan Africans have access to safe managed drinking water. And this is the lowest in any world region. And the third one that I've identified here is the spatial exclusion crisis. And this is talking about the percentage of Africans that are living in slums and informal settlements. And studies have indicated that about 53.6% of these people live in informal settlements, and this is the highest proportion in the world. And when we look at all these together, the crisis raises a critical question. Why has rapid urbanization not translated into healthier cities for millions of Africans? This particular question is one of the questions that are embedded on the central question that serves as the topic of this presentation. And in order to have an understanding of the aspiration, there is a need to define what healthy city connotes, because it will be a phrase that will bring many things to many people. In explaining this, I will go with the World Health Organization definition in 2016. The World Body defined the healthy city as one that continuously improves its physical and social environment and expands community resources that enable people to support one another in performing all the functions of life and developing to their maximum potential. When you look at this definition, you can see that there are 3 things that we can easily bring out here. Number one is that the healthy city is one that is dynamic. That is, it has to do with continuous improvement. It's the one that is environmental. It has to do with the physical aspects of the city. And it's the one that is also socially oriented, because it has to do with performing all the functions of life that can create human well-being. And based on this, we can say that a healthy city has 5 core pillars. The first one that I've identified here, based on recent literature, is the clean environment. That is the one that ensures that low pollution levels and respiratory health are available for all citizens. Also, there is the pillar of reliable wash. That is to ensure that water supply, sanitation, and hygiene are provided universally to all the people, and the infrastructure for this purpose is put in place. Another dimension, another pillar, is the affordable housing, because housing itself is a net intervention. Therefore, securing safe, stable, and cost-effective living environment for everyone is a core pillar of a healthy city. And there is the aspect of supporting the green agenda, that is to have green spaces. When parks and natural areas are integrated, they support mental and physical recreation, and then the city is considered healthy. And lastly, there is the pillar of equitable services. This one guarantees that there is equitable access to healthcare, education, and social infrastructure for all. So according to the World Health Organization, when a city is experiencing these 5 areas, then we can see that such a city is a healthy city. Now, when we are talking of healthy cities, and we are relating it to urban planning, we need to ask the question why urban planning should be considered of importance to urban needs. The reason is not far-fetched. Urban planning constitutes various areas of human life that is living in any settlement, especially in the city. And when we, sorry, like somebody is saying that he cannot hear from his end. Okay. Please indicate if you can hear me as I'm presenting. Sorry. Okay. Maybe it is the network of the person. Somebody has indicated that he can hear. Thank you so much. So when we're talking of the importance of urban planning in order to achieve healthy city, you can look at the planning activities in relation to what are the products of urban planning. And looking at the aspect of housing, we can say that housing quality and density, when they are of good quality, they address overcrowding and drive away diseases. And as a result, we can conclude that decent housing is a health intervention. Planning also has an aspect of mobility and transportation system. It has been established in several literature that active travel reduces non-communicable diseases such as obesity and hypertension. And like in Oxford here, people talk of Oxford as a city that supports active travel because you can cycle and you can walk because of the infrastructure that has been put in place. And that is through effective planning. And also, planning supports adequate provision of water supply and sanitation. And these encourage the hygiene practices of the people. And we know that what remains the historic foundation of urban public health anywhere in the world. And the planning activities also support green urban agenda in order to ensure a good environmental quality and improves mental health, improves cities, and reduces pollution. In the same way, we have land uses that are produced to ensure that there is reduction in net inequalities. And lastly, planning supports participatory governance, which gives community voice and improves plan quality and also health equity. Therefore, we can conclude based on the flow chart that urban planning decision contributes to build urban environment and influence lifestyle and exposure, and also lead to good health outcomes. So we can say, in essence, that many diseases are not originating from biological causes alone, but from environments that people inhabit, that they transfer and they breathe in daily. So this establishes the essence of urban planning in achieving healthy city. Now I'm going into the core interrogation of this particular topic, framing the crisis. As I have said earlier, and as contained in the topic, we have the component of processes, the component of practices, and the component of possibilities. The component of processes looks at the formal governance and regulatory frameworks of planning. The practices is talking about realities of implementation across African cities, and the possibilities focuses on paradigm shifts to deliver healthy cities in Africa. Starting with the processes, the World Health Organization has indicated, even currently in this year, that the healthy city is defined by its process and not its outcome. That means to have a healthy city, there is a need to take a critical look at the processes of urban planning, if urban planning will be able to deliver healthy cities. And I want to go historical in the sense of discussing the processes of urban planning in Nigeria. I have four categories or four areas that I'm focusing on. The one that is starting with colonial legacies, and then followed by post-colonial neglect, structural adjustment, and lastly, contemporary urban crisis. The colonial legacies of in the colonial era is focusing on the period before 1960. I chose 1960 because this was the period when many African countries got their independence from their colonial masters. The planning in the colonial era in Africa can be tagged exclusionary, and that is because there was segregation, racial zoning, and extraction. There were areas that were defined for the colonial masters, and then there were indigenous areas that were deliberately neglected and underserved and were not provided with the necessary infrastructure. Then after the independence, that is from the 1960 to 1980, there came the period of rhetoric of development, but weak institutions. Many master plans that were produced in many African countries during this period were based on models from the Western world, and they were not relevant to African realities. And in the 1980s to 1990s, then came the period of structural adjustment. That was when the IMF and the World Bank conditionalities were gotten planning agencies. There was a slash in infrastructure budget, and then this resulted into accelerated informality. And from 2000 to the moment, we are also facing another set of challenges. And these are emanating from fragmented governance, donor-driven agendas, smart city fantasies that are disconnected from mass poverty, and also disregard for local planning content. These are the historical, the summary of the historical African planning system and the various failures that have been associated with them. And looking further on the aspect of process, there are certain structural constraints that I have identified. Some of these emanated from inheritance, some of these emanated from importation, and also from mismanagement. And I have 5 here that I have identified that I'm presenting here today. The first one is colonial land and planning laws. It is a structural constraint because land tenure and planning system inherited from the colonial administration are rarely reformed. They were just, in some places, like in Nigeria, there is a nominal change from calling them ordinances to calling them acts of the parliament, but the content is in many cases remaining the same. And not only that, there are imported planning ideas. The Western and Eastern blueprint standards apply without contextual adaptation to African conditions. Yes, that is very common in the setting of Africa. Let me cite an example of my country, Nigeria, in this case. Our national capital, Abuja, was established, the law that established it came up in 1976. And then the then federal government called on an American company that is called International Planning Associates to come and prepare the master plan for Abuja. Eventually, based on what we read, the master plan of Canberra was imposed on Nigeria, and we are still battling with the issue until this moment. That was the idea was from the Western world. Then came, now in 2026, it is just happening that the Federal Capital Territory Administration is now reviewing the master plan after 40 years. And the administration of Nigeria has gone ahead to contract a Japanese firm in order to do the review of this particular national, of the master plan of the national capital. And that means when American idea came and we are still battling with the problem, now we're having a Japanese experience being introduced onto African or Nigerian soil, which is not facing the reality or touching the reality that we have on the ground. And we also have the component of fragmented governance. National, municipal, and traditional authorities often operate with overlapping and contested jurisdictions. In many cities in Africa, we have the problem of who owns the city, who is in charge of the city. There are the activities and functions that are carried out by the national bodies and also subnational bodies. All these are creating pluralism, and also the overlapping functions are breeding ineffectiveness. Also, there is weak enforcement capacity. This is because many planning agencies and departments, they are under-resourced, both financially, based on equipment, and also based on human resources. And they are unable to enforce regulations and also to monitor compliance. And lastly, I've identified what I may call the strongest of the structural constraints, and that is poor political will. Many of the members of the political class, they depend on short-term political, they look at short-term political interest, and this often undermines the sustained commitment required for long-term planning and net improvements. When we look at this chart, that is an indicative assessment of planning system capacity across selected African countries, we may be able to observe better the issue, the processes that we are talking about. you will see that here I have put the 6 countries, Nigeria, Kenya, Rwanda, Ghana, South Africa, and Ethiopia. And there are 5 components in which they have been assessed. When you look at the first column in each category of, for each country, that is focusing on legal framework. You will see that nearly every country has been able to do well in that aspect. Even Nigeria and Ghana are able to score 3 out of the maximum of 5. But when it comes to other components, such as implementation, health integration, community action, and financing, you will see that no country has been able to achieve much based on what they achieved in the area of legal framework. This is an indication that there are laws, there are legal provisions for planning in Nigeria, but the problem is their implementation, the problem is their health integration, the problem is their community inclusion, and also they have been subject of inadequate financing. So this is the situation with the processes of planning in Africa. And now let me go to the practices. The component of the practices as given in this particular presentation has to do with the realities of African urban planning and how they are shaped by the nature of its processes. And I've identified 6 issues that are emerging, raising their ugly heads when we talk of planning practices in African urban health. The first one that I have here is technocratic planning. And what I mean by this is that in many cases, plans are designed by professionals for elites because communities that are mostly affected by the planning decisions have no meaningful voice. In many cases, what they do is tokenism or cosmetic for community participation, just to make to document it that the people have participated in the decision making. And also, there is the issue of sectoral fragmentation. In this case, we do not see health ministries and urban planning agencies as partners, and they rarely communicate. Environmental health impact assessments are legally required in only a handful of African states. And that is because we do not see the essence of any collaboration between those ministries that are having to do with health and urban planning. Let me say this to quickly illustrate this transdisciplinary approach and how it can be very essential. I have an AfOx colleague here that we are living in the same apartment. He's into genomic medicine or human precision, and we were discussing one day, and when somebody is looking at it superficially, there is no area of intersection between somebody that has studied urban planning, I mean myself, and my colleague who has studied human genomics. But as we were discussing, he was now talking from Tanzania, and he's now talking that about his decision to ensure that people have better access to genomic counseling and some other things that are in his field. And he was thinking that Dar es Salaam, that is the capital of Tanzania, is at the tip end of the nation, and there are people that are in thousands of kilometers away. Then I began to talk about some planning theories that can be applied in making decisions in the process of the decentralization. And eventually, we brought the idea together, and we see that we can even carry out the research together, write the paper together, to the extent that we have been able to call on 2 other persons, one woman geneticist from Nigeria and one urban planner from Tanzania, to see how we can work together. That is an indication that if at that particular level it is possible to have an intersection between urban planning and genomic medicine, that means it is possible for health ministries to liaise very effectively with the urban planning agencies. And also, there is the aspect of chronic underfunding, and that is because African cities are solely underfunded for infrastructure development. And the planning budgets of many African cities are dwarfed by those of comparable European cities. We cannot but also talk about land tenure insecurity, because without secure land rights, some residents cannot demand services or invest in improvements, and they can be subject to forced eviction. All this will destroy health gains. And not only that, there is what I call climate blind planning. That is, many master plans or development plans that are produced in African cities, they are old and they are blind to climate change. The climate reality that we are facing today, they do not address them. And as a result, the contemporary heat stress, flooding, and drought, they are not taken care of in this kind of master plan that are being produced. And lastly, I have the issue with planning practices in relation to data poverty. You will agree with me that planning requires data, because if you want to make an informed planning decision, you need to have quality, adequate data, qualitatively and quantitatively. But unfortunately, most African cities lack reliable sensors and spatial data or real-time monitoring system. These are the issues with practices of urban planning practices in urban areas in the continent of Africa. And I want to look in particular into one that is a lived reality, the one that we call informal settlements. You will notice that I'm quoting informal settlements on this slide, and that is because what informal settlement may connote technically may not be what it actually connotes. And you will see this in my presentation. The concept of informal settlement has been defined as communities that emerge outside formal planning system and lack adequate tenure security, infrastructure, and services. And the international bodies such as the UN Habitat and the African Development Bank, they have come up with figures that more than 50% of urban Africans live in informal settlements and slums, with significant variations across countries and regions of the continent. But as an urban planner who is in the global south, who is in Africa, I have a perception that is different from this. And that is that when we are looking at informal settlements, we can also see it not just as an area that is emerging out of planning system, but as a community-driven pattern of urban development in which residents respond to planning and service deficits through self-organized infrastructure and local coping strategies. People that are familiar with the setting of urban Africa, they will agree with me, especially in the development of peri-urban areas in our cities, that what we have there now is not what we used to we even have in some core areas that are well planned. We jokingly say that we say this in Nigeria, and this could be similar to what operates in some other African countries, that every household is a local government. And that is because the community people make road to their houses, you provide your own water in your compound, you provide your own sanitation, and you also know how you manage your own domestic waste. So what is done by the municipal government has been transferred in many cases to the household head and the household people. In this case, we are not talking of areas that where people are squatters. We are talking of those areas that were developed by people themselves, that they can even claim to have secure tenure in the land that they are building on. And in most cases, when we are talking of response to this lived reality is experiencing neglect. Sometimes they are ignored and left outside the formal planning system, and in some cases they are deprived. That is, there will be adequate services, and they are subjected to environmental hazards and poor health outcomes. And also there is exclusion. No consideration for in-situ upgrading or participatory planning and integrated services. And in some cases, there is experience of demolition because residents are forcefully evicted and communities are destroyed. In this case, it is not that I'm trying to romanticize informality, but the fact is that it is a lived reality that we need to consider, because if there are more than 50% of the people, then eviction or demolition may not be the right approach to ensure that the cities became healthy. Now, I can say that it is not only a story of woe in the African cities, because there are some emerging good practices across the continent. And emerging experiences across Africa demonstrate that alternative pathways already exist. And here I have the examples of about 6 cities in different countries. We have the Kigali in Rwanda that is having a master plan that envisages centers at every 500 meters, ensuring walkable neighborhoods, green corridors, and deliberate collocation of planning and net functions. Kenya, we have the city of Kisumu too, that is using community action planning in order by linking residents in slum upgrading. And once infrastructure is improved for residents and community health workers are embedded in special data collection. In Cape Town, South Africa, there is climate health nexus, making the city to link urban greening, cool corridors, and health facilities preparedness. And this is one of the Africa's first health planning framework. And in Ghana too, there is the Ghana Community Health Planning and Services, with talking about places that places health workers in planned zones with deliberate spatial coverage. The city of Addis Ababa in Ethiopia and ensure housing and health nexus through condominium housing program, which rehouse slum residents, integrating primary health clinics in new developments. And also in Lagos, Nigeria, there is Lagos Health Initiative that focuses on universal health coverage using mobile health units coordinated with spatial data. This is an indication that there is an emerging experience across Africa that can demonstrate that possibility can be achieved. And that takes me to the third lens, the third component of the seminar, possibilities. In this case, I'm talking about the paradigm shift, that is what involves changing perspectives and also transforming practices. And there are some possibilities for transformation that I've identified. And this is because achieving edicity in Africa requires a fundamental paradigm shift in how urban planning is conceived, how it is governed, and how it is practiced. There are 8 of them that I've presented here, and I will briefly talk about them based on the discussions that I've had earlier. They are reactions to the issues that I've earlier raised in the components of processes and practices. One is that there should be a transition, a movement from imported models to contextual African solution. This is very necessary in order to address the issues that are on ground and for the lived realities of the people to become better. Not only that, there should be planning should not be seen as a technical, as just a technical exercise alone. It should be seen as a tool for health and well-being of the people. Then there should be a movement, a transformation from exclusion to inclusion and participation. And this kind of participation must be meaningful. It must not just be tokenism or a kind of cosmetic participation. Then informality, which is part of the urban realities in Africa, should not just be seen as a problem, but as an asset. If people can enforce certain things to make their life better in their so-called informal settlements, that means those ideas can be worked on by the technocrats to improve the situation of cities in Africa. Then there should be transformation from silos to transdisciplinary model. I talked about this the other time. Integration of planning, public health, ecology, engineering, social science, and community knowledge into genuinely transdisciplinary urban health frameworks is very, very essential. Also, there must be change from rigid blueprints to adaptive planning. It is essential because things are changing rapidly. Climate change is there, technology is improving. Therefore, planning must also be responsive to the changes in the society. And there must be transformation from weak capacity to investment in local institutions. Yes, this EDCT can be driven by local institutions. As a result, substantial and sustained investment must be made in local planning capacity in order to ensure enforcement, infrastructure development, GS capability, and professional development within African municipalities. And lastly, there must be a transformation from aspiration to political will and wisdom. This is because the gap between EDCT aspiration and implementation reality is fundamentally a change of good governance and political will. Now I'm concluding. And my conclusion is starting with the statement that EDCTs in Africa will emerge not from planning as usual. And this takes me back to the question that I started with. Can urban planning deliver EDCTs in Africa? The answer that I provided here are in threefold. not as currently constituted. Because planning systems that are fragmented, under-resourced, politically captured, that is the one that's been dictated by the political class, and disconnected from health system, cannot deliver healthy cities at the required scale. Also, I have it here that transformation is possible. And that is because evidence from progressive municipalities across the continent shows that planning can be reoriented towards health equity and healthy cities, where political will and resource exist. And eventually, if fundamentally reformed, health integrated spatial planning will join participatory governance, and there will be climate sensitivity, there will be effective land reform, and also there will be institutional, in addition with institutional strengthening. All this will culminate into a realistic, evidence-based pathway for African city to become the true urban planning. So I am concluding here that the future of health of African cities does not depend only on the healthcare system, but depends fundamentally on how we plan our cities, who plans them, for who, and with what values at the center. Before I stop, I need to acknowledge some individuals and institutions. I want to start by acknowledging the AfOx initiative, Africa Oxford initiative, that is the AfOx, for the opportunity I have to be here in Oxford, especially during this month, 2 months of residency at the University of Oxford. And I must also appreciate the Global Center on Healthcare and Urbanization for hosting me. Notably, I acknowledge the support of my host, David, and also I must appreciate Juliet Neno and the entire team in the center. I appreciate the Kellogg College of the University of Oxford, from the president to the board members. Thank you so much. I remember my staff and students at the Department of Urban and Regional Planning, Obafemi Awolowo University, Ile-Ife. Thank you for your support. I know several of them are online and they are hearing me currently. The dean and staff of my faculty of Environmental Design and Management in OAU Ile-Ife, thank you so much. My first chancellor was the one that facilitated my release in order to be here in Oxford. I thank you. I thank my family too, my wife Oluwole and my children, Temitayo, Temidayo, and Temitokwe. My colleagues on the AfOx Visiting Fellowship Program, thank you so much. Some of them are here and some are online. I appreciate you. And all in-person and online participants, thank you for making this seminar a success. And above all, I thank the Almighty God for His grace and favor. Thanks so much. And I will be available for your questions and possible discussion. Thank you.